It looks like nursing in the UK requires you to write so many exams. The exams are not so many, they are just 3. And if you are coming from an English speaking country, then you are going to just write the CBT and the Osce. But if you are coming from a non-English speaking country such as Africa, Caribbean, and Indian, and the Asians, then you would have to write the English test of competence, which is the IELTS or the OET. You write your NMC CBT in your home country, and then you start your registration process. So I have done a couple of videos on how to apply for your visa. I've done a video on how to survive your first month in the UK. I've talked about salary issues. I've talked about grocery shopping, how to get an apartment and all that. You can find them in my suggested videos up there. And if you want to watch, you can also watch. Hi guys, welcome to my channel. My name is Rebecca Ajiman, a BSc RN from Ghana, currently practicing in England as a registered nurse. To all my returning subscribers, I say a very big thank you to you. If it is your first time of coming across this channel, I recommend that you subscribe, turn on your post notification bell icon. That way you wouldn't miss any time I upload a video. To my 10 subscribers, I say a very big thank you to you. I'm on self-isolation for 14 days and I'm using this opportunity to do more sit-down videos. For those of you who keep asking of me, I am doing very well. I am currently so fine and I can't wait to go out. This is the longest 14 days of my entire life and it's quite boring, but I'm also enjoying it and learning some things from it as well. And today I'm going to talk about the Osce exams, because some of my subscribers who are ready to move to the UK have drawn my attention to doing videos on it to benefit them. So if you haven't heard of Osce exams, this is the objective structure clinical examination. That is the final point of your registration process, and this is a practical exam that you need to do to demonstrate your nursing skills to the NMC of UK to get your PIN, that's your personal identification number, to fully practice in the UK as a registered nurse. And I always tell people that do not start learning about Osce when you haven't arrived yet in the UK, because you are not so used to the system of working in the UK. I recommend that you move to the UK first, know how the system works, and then you can prepare for your Osce. Most of the trust or care homes give you a personal trainer who is going to give you all the tips and guidelines for you to adequately prepare to set for these exams. They're also going to give you materials and everything that you need. I want to state a disclaimer here that I am by no means and no way an expert Osce trainer. I am also a test taker who have gone through the process, and I can talk something about the exams. So I'm just like any nurse at all. I'm just giving advice to my other colleagues who are yet to go through the process. Within your first 2 months of moving into the UK, you are expected to sit for your Osce exams, and you are going to be trained by your personal trainer that will be given to you by your trust or your care home. So no need to worry about that. But the challenge is, within this period, you are still working as a band 4 or as a pre-registration nurse, and you are still preparing to take your Osce exams. So it's kind of like torn in between work and studying. So you have to apply proper time management skills to be able to pass these exams. Look, don't let your guard down. You've worked so hard to go through this phase. You've passed your IELTS, you've passed your CBT. You are now in the UK and you need these exams to get your PIN to start on the band 5. Don't let your guard ever down. Put in every effort you need to pass these exams and pass it at first attempt if you have to. So there are basically 4 centers. That is Oxford and Swindon. We have Ulster in Northern Ireland, and we have Northampton. That is where I took my exams, of course. And the price of the exams has now been reduced by the NMC of UK because we need nurses. So it was reduced to 794 for all the 6 stations. However, if you have to take a reset for maybe 1 or 2 stations, you are going to pay 397 for the stations that you have to reset. So the price for the whole exams is 794, which is mostly paid for by your trust, unless you are a private candidate. That's if you are registering on your own to sit for the exams. And that is why I advise you to get a certificate of sponsorship from an employer here in the UK who is going to sponsor you. So it is the duty of this employer to pay for all these things and even more to make sure that you acquire your PIN. So if you are with a trust or the care home, they are going to book you. And if you are an individual, you have to go to the NMC's website and then you book for yourself. Regarding materials, the materials I will recommend for you to pass your Osce, aside what your clinical instructor is going to give you, is the Royal Marsden's Clinical Handbook for Nursing. That's the 9th edition is out. So you can make good use of the 8th edition or the 9th edition if you have it. You can also make good use of YouTube videos that people have done talking about how to pass your Osce exams or how to prepare for your Osce exams. You can also use Google search to search for things that you are not so sure of. For the wait period for the exams, you have to wait for a period of 3 to 5 working days to get the results of your exams. Some can come as early as 24 or 48 hours after the exams. And after you've had your results, if you are part of the old system, that is, if you did your registration before the 7th of October 2019, you are going to wait for about 48 to 72 hours to get your PIN. And if you registered after the 7th of October 2019, you have to wait for a whooping 35 days. That's about 6 weeks to get your PIN. So this PIN is a statement of entry that is given to you by the NMC of UK, stating the date that you had your PIN, the day that you're going to renew your PIN, and the day for your re-evaluation. And if you are part of the old system, after you've had your congratulatory message from the NMC of UK, you are going to pay £153 to the NMC of UK's account before you can get a statement of entry. However, if you are in the new system, you do not have to pay anything at all. All you have to do is to wait to get your pay. Okay, so I'm going to divide this video into two. I'm going to do the APIE in this video, and I'll do the skills in a separate video. So the APIE simply stands for assessment, planning, implementation, and evaluation. So with assessment, you go in and you are giving your patient in the form of a nursing mannequin. You have your assessor, you have cameras around, you know, to record whatever you do. For confidentiality purpose, I can't tell you exactly what happens in the test room because you are made to sign a confidentiality document that you are not going to disclose any part of the exam to anyone. So I won't be able to tell you what exactly goes on in the room, but I'm just going to tell you how to prepare for it. So always try to wash your hands according to the WHO standard. Wash your hands according to the WHO standard. If you can't wash your hand, use your hand gel when appropriate. When you touch surfaces, when you touch your patient or your nursing mannequin, try to wash your hand as much as possible and demonstrate your hand washing skills. The next thing you have to do is to be courageous or to be, confident throughout your exams. Once you begin to panic, once you begin to become anxious and anxiety takes over, you can't give out your best because you have to demonstrate professionalism and great nursing ethics throughout every station that you go to. Try to be courageous and remember the NMC's 6 C's. So apply your care, your courage, your commitment, your competence, and all those skills throughout each station that you go to. Try as much as possible to introduce yourself to the patient. Ask what the patient would like to be called and check for allergies. So ask of how they react to these particular substances when they take them and assure them that you are not going to administer any of these substances throughout their period of hospitalization. Also check for identity of the patient before you do anything at all. To be sure it's the right patient, check for their name, their date of birth, and their hospital number. Always seek consent from your patient before attempting to do anything at all. So seek the patient's consent, ask them if they'll give you the permission to carry on with the procedure that you want to, carry on. It's a nursing mannequin, but treat the mannequin as a real patient as you would do in your day-to-day activities. And also speak loudly and be audible enough, because sometimes the examiner might not hear what you are going to say, but the cameras are going to record you, and if they have to do a playback to be sure if there is something you said or didn't say, and you don't speak loud enough and the camera can't record you, then it's not safe. So speak loud enough and make sure the cameras are recording you. Also focus on whatever the patient tells you. So don't try to quickly go through your assessment, without focusing or paying much attention to the details that the patient gives you. So for instance, you've asked the patient, how do you feel, or what brings you to the hospital? And they begin to tell you their problems. Pick the problems that they are telling you, and that can even help you in your planning. So always try to listen to them and answer their questions appropriately. If they say anything, try to show concern and let your care and your ethics, be at display. So this station takes 12 minutes to be completed, and you have to complete everything you want to ask your patient by the 12 minutes. Don't forget to hand over the call bell to your patient at the end of each station or each procedure. So you tell the patient, here is your call bell. You can press on it anytime you need my assistance, or anytime you need the assistance of anyone at all. Always hand over the call bell to them before the station comes to an end. With planning, you are going to select 2 relevant nursing problems and develop them. Always try to make sure that the problems you are selecting are very relevant and are your top priority for the patient. So for instance, if you identify the patient has shortness of breath and is in pain, and that same patient has mobility problems or is at risk of infection, don't let your risk of infection and mobility problem be your top priority whilst the patient also has shortness of breath. So the shortness of breath, of course, should be your priority. So that should be your number one problem, and any other thing can follow. So try to prioritize the patient problems and develop them appropriately. Also choose your re-evaluation date and time carefully. So you'll be given a time in your paperwork. So you will see, assume it is so and so this time. So make sure when you are re-evaluating, you choose a time that is later that same day. So you develop the problem today and you are going to re-evaluate the same day but at a later time. Don't choose another day. Always try to re-evaluate within the same date that you identified the problem. And also, when you are writing your patient's self-care needs, choose at least, I always say write at most 4. So choose what you wrote for your nursing care and then turn them into the patient's own self-care needs. And always remember to write your name, sign, and write the date at the end of the station. Plan is similar to evaluation, because in evaluation, it is a transfer of care. So everything you've written from assessment to everything is going to be given to you. So they write an evaluation of care. So sometimes maybe you've taken care of the patient, the condition has deteriorated or it has improved. You're going to be discharging the patient back into the community. You have to write a transfer of care letter to whoever it may concern. So you have to write all the things you've identified from assessment through planning through implementation into your evaluation paperwork, and that is so easy. The only thing you have to do is to pay close attention when you are transferring. Try to make sure that everything you've written from assessment through planning through implementation reflects in your evaluation. And also remember to write your name, sign your signature, and write the date. So let's move on to implementation. About medication administration, and you have to demonstrate that you can safely administer medication. And the medications you are going to administer are mostly or all the time they are oral medications that you have to administer. Always remember your right of medication administration, right time, the right date, the right documentation, and everything. Also make sure that the prescription you are going to administer from is legal and legible, and you can actually see what has been written clearly. You can read it. You can see the signature of the prescriber, his bleep number, and everything. So read everything from head to tail, or from top to bottom. So when I give you evaluation papers, go through it from page to page. So on page 1, you read the patient's detail on top. You confirm that it's the right patient. You've met your first right. You confirm that it's the right time. Look at the date and the time of administration. If it's been written that the medication is supposed to be started tomorrow, it means you shouldn't administer at all. If it's supposed to be administered today, look at the time. Is it due to be administered? Always try to wash your hand. If there is anything you are not sure of in implementation, please consult your BNF, which will be provided to you. Maybe you want to see about a drug reaction, a drug interaction, or you're not sure about the dosage or something of that sort, the side effect or anything, you can go to your BNF. Always try to tell the patient what the drug is meant for and how they are, what they should look out for in terms of side effects or any reactions or anything of that sort. Document appropriately at the end of your administration of the medication. There are some medications that when you are going to administer, you have to check for some vital signs or for some observations. So like if you're going to give the digoxin, you should know that you should check for your heart rate or your pulse. If you're going to give an antihypertensive like lisinopril, you have to check for your blood pressure. So do your checks. If there is a medication you're going to check and it requires you to do any check, do your checks before you give the patient the medication. Remember to document appropriately, have your signature and the time that you administered the medication at the end. If there is any medication you didn't administer due to any reason, you will be given a code at the back of the paper. Try to put in the code and the reason for not administering the medication. So maybe you didn't administer, let's say, digoxin because the heart rate was low. It's for a clinical reason that you omitted the medication. So go to the back of the paper. There are some codes there. Put the code and write the reason why you didn't give digoxin. So if you do this, your APIE is going to be successful and you've already passed in advance. So that is the end of the APIE. In my next video, I'm going to talk about the skills and how to assay it. Thanks so much for watching, for liking, for giving this video a thumbs up. If you think you like this video, do all to share, subscribe, turn on your post notification bell icon. That way, anytime I upload a video, you'll be notified and be able to watch. It's bye for now. See you in my next.